everybody. As a lot of the folks have talked about, there's tons of new digital health apps on the market every day. And 90% of patients want to use something that their doctor recommends. But there's some problems, right? As a provider, how do you actually prescribe an app to a patient? How do you get it in their hand and make sure the patient actually gets it, downloads it, and can use it? And how do you actually get that data back in that you can use it in a useful and clinical way? Especially if the patient isn't using the personal health record, which most of them aren't. And then for health IT, you already have a long list of problems, right? And at the very bottom of your list of things to do is integrate some app into the EHR that some cardiologist thinks is a cool, neat thing to have. Yeah. So in order to actually build a digital health strategy as a health system and scale it, you're gonna have to solve all three of those problems. And that's where Xealth comes in. We take that burden off of the IS teams by taking on that third-party integration. We allow doctors to prescribe digital content like apps and videos all inside the EHR, just like they would labs and meds. And we get that data from those third-party apps back into that EHR where the care team can act on it through in-basket messages, best practice alerts, things that they can actually use to integrate that data into the patient's care without getting overwhelmed. Personally, I'm a psychologist by training. I came out here to Seattle to work for Department of Defense, building apps for veterans around PTSD and suicide. And the problem we had was actually getting these things into the clinical use, getting them in the hands of the doctors and in the hands of the patients. So when I saw Xealth, I thought, great, here's a company that's actually tackling this problem and gonna help make a difference and actually implementing a lot of these digital healthcare apps.